So hello everyone, my name is Bree Wilhite, and I am a current MPH student here at Harvard Chan in the Department of Social Behavioral Sciences, and I also am a maternal and child health concentrator here. So today I have the pleasure of introducing Dr. Kathleen Stratton. Dr. Stratton began her career at the National Academies of Sciences, Engineering, and Medicine in 1990 in the Institute of Medicine. She has spent most of her time with the Board on Population Health and Public Health Practice. She has staffed committees addressing vaccine safety and development, pandemic preparedness, environmental and occupational health, drug safety, and tobacco control. She was given the Institute of Medicine Cecil Research Award for sustained contributions to vaccine safety and made a staff scholar in 2005. She has most recently directed studies on accounting for socioeconomic status in Medicare payment programs and on the health effects of electronic cigarettes. She is currently involved in workshops on the intersections of infectious disease and opioid epidemics and on brain health. She received a BA in Natural Sciences from Johns Hopkins University, a PhD in Pharmacology and Toxicology from the University of Maryland at Baltimore, and completed her postdoctoral research in the Department of Neuroscience at Johns Hopkins School of Medicine. So without further ado, please join me in welcoming Dr. Kathleen Stratton.
Thank you all. Marie, it's good to see you again. It's good to be here. Let's see if I can remember how to do this. There we go. What this title should really be called is Marie McCormick. I always used to use those initials as the abbreviation in my notes for all the work that we did together, and it was a lot of M's and C's, but I never thought of it as maternal and child health. It was always Marie McCormick. And the National Academy of Sciences Population Health portfolio. I will talk a little bit about the breadth of work Marie has done with us, two very special projects that Marie and I worked on together, and I hope there to talk about some of the issues that I think are very evergreen, even though they were time limited for Marie and me. So what do all these important topics in maternal child health and population health have in common? Low birth weight, prenatal HIV screening, research design, developmental outcomes and measurement, environmental exposures. What do they all have in common? Marie. That's what they all have in common. So why did the academies, mostly the Institute of Medicine, now called the Health and Medicine Division, but other parts of the academies as well, why did we always turn to Marie for help? Well, this is why. She has depth in medicine and public health. She has strong methodologic and analytic skills. She's really good at reading group dynamics and is a consensus builder, and as we heard in the last session, crossing silos. She has a spine of steel, and we'll talk about that a little bit later. She has resolve and tenacity. She is wise. She's very empathetic, but does not suffer fools gladly. And she has, and this is one of the things I loved most because we had some tense moments, not us personally, but the things that we worked on. She has a very sly and wry sense of humor. 35 years ago, the Institute of Medicine released a report on preventing low birth weight. It was a committee of luminaries, and there was a young assistant professor from the University of Pennsylvania on that committee, and that was Marie. And that was the first work, if our internal database is correct, I believe that is the first work that Marie did for us. In 1982, I believe the rate of low birth weight was 6.8%, and now it's in the 8s. So this is an issue that is certainly evergreen, and I am not a physician or an MCH expert, and you all know more about why that is and the reasons for the statistic these days, but it began at the academies for Marie with maternal and with low birth weight. In 1999, Marie chaired, and this was mentioned a little bit earlier, all the work that Marie has done. Marie chaired a committee that released a report called Reducing the Odds. And this was also preceded by a 1991 report that Marie also chaired. So it was her second go-around on this important and controversial issue. These are sort of the big categories of topics that were in that report, of the recommendations and conclusions, which were not without their controversy. If it wasn't controversial, we probably wouldn't ask Marie to be involved. And I show this mostly to show the variety of topics in the report, showing the challenges that Marie found in steering the committee through a lot of landmines. And this is probably around the time that I met Marie for the first time. Here's where I'm going to spend a bunch of my time. It was mentioned earlier that Marie had worked on vaccine safety issues with us. So the National Academy of Sciences has a congressionally recognized and mandated role in vaccine safety, as put out in the 1986 National Childhood Vaccine Injury Act. And that program is run between HRSA and the Department of Justice. But this series was done for CDC. So CDC had a problem. This started in 2001. Andrew Wakefield put out his paper in 1998. There was the beginning of, not the beginning, it was the middle of a long history of concern about the safety of childhood vaccines. And CDC was getting a lot of pressure from mostly parents groups about what to do about vaccines and why aren't you studying this and why aren't you studying that? And CDC felt they needed help from an independent body to make sense of some of these worries that were out there. And so they contracted with us for something a little bit unusual, which is to do 3 reports a year for 3 years on individual topics of vaccine safety. To not only look at the evidence about whether the adverse event that was being observed was related, either associated or causally, but also to help CDC think about how much they should be worrying about this and what they should be doing and how should they be communicating about these risks and what research should be done. So when we thought around about what chair we were going to talk into this endeavor, we went to Marie. Inevitably, there was going to be a lot of research that wasn't clearly definitive one way or the other about whether or not these adverse events are related to the vaccine administration or not. Or there were going to be some adverse events that were very worrisome and that have been around for a long time. People have worried about whether the flu vaccine is causally related to Guillain-Barré syndrome since 1976. Probably even before that, but really starting in 1976, and here in 1991, we were still worried about it. We're still worried about it today. There was also a lot of societal concern and parental anger. And I will say that our public events, of which there were 8, were really rarely pleasant, although the work within the committee was always cordial, because that's the tone that Marie set for everyone involved in this project. Marie was pilloried by many during the course of this as the face of the Academy's voice, the Academy's face on this area. It was Marie. She still appears as a target of some anger. I think the latest blog post I saw was 2016, where Marie was pilloried. She did a beautiful and masterful job in front of the House Government Reform Committee when she was being attacked for not understanding what autism was. There was, unfortunately, improper access to National Academy's privileged material, information, which was then stolen by a member of the staff of the House Government Reform Committee and leaked and used in court proceedings. And in the state in which it was used, those confidential materials were made public on the internet for everyone to see. And the biggest target, of course, was Marie, where sentences were taken out of context over and over and over again, trying to put words and sentiments into Marie's mouth that anyone who knows her knows she would never say or mean. There were a lot of subpoenas. That was mostly my problem to deal with because they were to the academies and not to Marie. But it was just a lot of work, all because Marie and about 13 of her colleagues said 3 times that vaccines don't cause autism. And that was what we were putting up with. There were very silly and not very imaginative attempts to mock her. And yet she steered the committee with dignity and rigor. And then she went on a few years later to join the National Vaccine Advisory Committee, the federal group that advises on vaccine issue, and chair the H1N1 Vaccine Safety Working Group. Yes. So, what's evergreen about this? This is just Marie's and my personal history, which was fun. The vaccine safety concerns never go away. Could I get some water, please? And they never really should. But we still have outbreaks and pockets of unimmunized children. Sorry about this. So communicating scientific information to the public is really difficult. And I think that that's something that we learned. We all know it, we've all experienced it, but it really came home in this particular project. We tried very hard to turn the very formal, didactic expressions of strength of evidence and levels of evidence into something that would be meaningful to the public. And I have to say we probably weren't ever successful at that, but it's very, very difficult to explain. That is something that I really think needs to be done. I think since then some of the groups, not the least of which is the Guide to Clinical Preventive Services and other professional organizations that do evidence reviews, are doing better. We were stuck with a slightly a historical way of describing things. So I think that is something that remains. It's a challenge for population health to this day. I think balancing parental rights and the public health imperative is always difficult. Of course, I'm here in the state where the 1905 Supreme Court Jacobson v. Massachusetts was involved in the question about whether smallpox vaccination could be mandated. It can. I think that we're still grappling with less than ideal vaccine efficacy and how to explain that to parents, because it's the important part of the risk-benefit, especially with the influenza vaccine and perhaps the DTaP vaccine, not for all vaccines, many of which are incredibly effective, as we all know. I am fully immunized, so I can understand this, but parents have a hard time when they find out that the CDC puts out data that vaccines are only effective, but yet you had to give them to your child, and they're worried about the side effects. Excuse me. And I think it's also hard explaining to the public when and why conclusions about evidence changes. When there's the accumulation of new studies, new evidence, and you can say, well, we didn't really know in whatever year whether the flu vaccine causes Guillain-Barré, but a couple more studies and now we do, and they want to know whether maybe you didn't look hard enough, the first time around. What has changed? And that's a tedious and long and technical thing to explain. And I don't think that we know the answer to that. Sorry, these are just the topics that this committee dealt with. You can see autism 3 times. A lot of worry about demyelinating conditions, hepatitis B vaccine and multiple sclerosis, flu vaccine and Guillain-Barré. And we worked on these for a long time. In 2017, well, when we started, it was 2016 when we started, Marie and I think, found out that we were getting a little bit older than perhaps some of the topics, because pot was now called weed and marijuana was now called cannabis. So we had to change our vocabulary a little bit, but we did it. I will say that this report is the 8th most common download from the National Academy Press website. It has been downloaded 80,000 times. That's a lot for us. That's really a lot for us. So good job, Marie. And it keeps going up. I mean, I looked at the little chart just the other day. So as many of you know, 9 states and DC have legalized recreational cannabis use, and 29 states have medical marijuana. Over 200 million Americans have some kind of access to marijuana in some legal sense. This project was tough. Marie chaired this committee. It was really tough. It was a short time frame. There was a lot of literature, but in fact, the relevance of much of it was up in the air, because marijuana. No, cannabis as a product has changed a lot since I was in high school. Not that I would know. It's more potent. It's very, very different. So comparing the data from studies back then to now is hard. Most of the studies are observational, and federal law makes research very difficult. And people are using it for a wide range of conditions. And here I have you can just look at that if you would like. Marie, of course, there were questions, of course, about the use of cannabis by pregnant women. There was a study released in late 2017 conducted by Kaiser Permanente Northern California that said that between 2009 and 2016, use of cannabis by pregnant women went from 4.2% to 7.1%. There was another study, another JAMA study that showed lower numbers, but still seeing an increase in the use of cannabis by pregnant women. So physicians and public health practitioners really need to know what to tell women. Because you need to have evidence, you need to know what the data are. Use in teens is on the rise. The incidence of one or more use of marijuana in the last 30 days is going up, one of the many metrics in these surveys. In 1991, it was 14.7%, and in 2013, it was 23%. There's been a slight decrease the last 2 years in the past 30-day use. And what's interesting, the rate is so much higher than tobacco use, than cigarette use. So while we've done a great job at getting teens not to smoke cigarettes, the use of cannabis is certainly increasing. These are obviously important findings of great value, and I will say that I know that states around the country are using this material, repackaging it, looking at their particular list of conditions for which it can be used for medical uses, and beginning their communications and their understanding with that report. I think that the evergreen lesson here, again, is that healthcare practitioners and public health practitioners don't have the time or sometimes the skill to make sense of voluminous bodies of literature, especially if it's someone outside of their field. So they need somebody to do it. We have often provided that role at the National Academies in a variety of topics, and we certainly did it here. Again, Marie, I don't know what your experience was in trying to talk about this afterwards, but communicating that formal language that the committee used about the evidence, as when the vaccine stuff, it's really tough. It's really tough. There's a need for updating, obviously, because as more and more people use marijuana, it's legalized, there'll be more studies, there'll be different studies. So how do you decide when to update a body of literature in terms of providing advice to practitioners or to the public about what the current state of the science is? We've seen that in both vaccines, and it will happen in cannabis. And then there's 2 other small points, but there's a lot of shoddy reviews out there. There's a lot of systematic reviews using the kind of methodology that the Institute of Medicine laid out, as well as many, many others. There's really sort of a lot of shoddy reviews out there. And understanding that and going through what a true systematic review is really changed some of the committee members' lives who had never been involved in that sort of a thing and gave them a different perspective. And just the experience of working in a team and doing evidence reviews, I know, changed the professional career path, the track of at least one member of that committee. And that's something many of you have been touched by Marie, but there are other people out there who just for these 1 year, 2 year stints, she was able to change their career. So why does population health need people like Marie? She's willing to tackle the tough and complicated issues. None of them have gone away. Wisdom, rigor, and integrity never go out of style. And so on Marie, on behalf of Kata, Sarah, Mike, Alicia, Donna, Michelle, Lee, Jennifer, Rose, and me, thank you for, all you have taught us and all the time you gave to the academies and all the good work that came out of it. We're indebted to you. And I just want to see if you recognize these 3 little code words from our years together. The McCormick Spice Bottle, a dark-haired European researcher, and leopard-spotted bathrobes. She does remember all 3 of those. So with
That coaster would be worth thousands of dollars.
I have a couple of them I can put on eBay. So maybe at the reception we'll tell you what the bathrobes and the handsome European researcher is all about. So on that, thank you very much, and thank you.